50. For a 2-year-old man presented to emergency department with a 7-day history of severe biliary diarrhea and abdominal pain. He has previously been fit and well with no significant medical history. On examination, the patient dehydrated with generalized abdominal tenderness but no clinical evidence of peritonism. Abdominal recovery formed, which is usually finding would be most suggestive of toxic colon. Multiple mucosal island in a dilated transverse colon, which radiology find would be most suggestive of toxic colon. Multiple mucosal island in a dilated transverse colon. Question number 51. The 7-year-old male presented with acute gastric pain and hematosis for the last 2 days. Last 2 days, he does not have any known comorbid, but however used to take NSAIDs for migraine quite frequently. His physician ordered for by meal examination, which revealed multiple rounded ulcers associated with the name of surrounding halo and antral region. The most likely diagnosis is acute erosive gastritis. Now the thing is, one hint is that he had acute gastric pain. Then he used to take NSAIDs for migraine. Now then on during a meal there were surrounding ulcers associated with rim surrounding halo antral region. So diagnosis acute erosive gastritis. It is seen in the antral region most common. Okay, now he had rim of multiple rounding ulcers associated with rim of surrounding halo and antral region. Acute okay. Then SAIDs then immune to multiple rounding ulcers with rim of halo. So the rim of halo seen in acute erosive gastritis. Question number 52. 50-year-old woman who had been treated for cervical carcinoma 18 months previously presented with colic abdominal pain. A CT showed a thickening of the ileal wall with luminal narrowing to the causing part obstruction. There was also increased attenuation of the associated mesentery, with most likely diagnosis radiation enteritis. Hint is that treated for cervical carcinoma 18 months previously, and then he has thickening of the bowel loop, so diagnosis radiation enteritis. Question 53. With a 45-year-old female presented with reflux underwent barium swallow. There was an incidental finding in the cervical esophagus near the pharynx, where a thin membrane of uniform thickness 2 mm extending from anterior esophagus was visible. The past medical history included treated hypothyroidism and investigation for iron deficiency anemia. Most likely diagnosis would be plumber-Wilson syndrome. So a patient had barium swallow and there was a thin membrane of uniform thickness from the anterior esophageal wall extending, and she had iron deficiency anemia. So these two signs combined diagnosis is plummer-Wilson syndrome. Question number 54. A 68-year-old woman presents with malaise and abdominal pain and is found to have abnormal liver function test and abdominal ultrasound identified multiple hypertrophic lesions in liver and contrast hence CT of the abdomen demonstrates that these are hypervascular liver metastasis. Given the CT finding, what is the most likely underlying diagnosis? Carcinoid. The hypervascular liver mets is seen in carcinoid. Question number 55. 29-year-old sick male presented with complaint of repetitive vomiting and abdominal cramping. CT scan abdomen shows a fifth angle of 15 degrees between supramesenteric artery and aorta. Pair immune and follow-through examination is suggested for further evaluation. Where least supportive prime follow-through examination finding for diagnosis of supramesenteric artery syndrome. Titration of duodenum up to ligament of treat is the supportive findings. Because in supramesenteric artery syndrome, there is relief of complaint by postural chain. There is vertical linear compression defect in third part of duodenum. There is distended duodenum proximal to obstruction. The stomach may also be distended, but there is no dilatation of duodenum up to ligament of treats. Question number 56. A middle-aged lady presented with anemia and ongoing melena for 6 months. Colonoscopy and blood biochemistry was normal. Enhanced CT scan. Abdomen showed a well-defined intraluminal hyperdense mass in the most likely diagnosis is leiomyoma. The middle-aged lady with melena, and then she had well-defined intraluminal hyperdense mass in the jejunum, most likely diagnosis is leiomyoma. Question 57. 26-year-old female presented with long history of abdominal bloating, pale loose stools, and weight loss. She underwent a series of investigations, including a small bowel edema and eventually polygenetic biopsy, was diagnosed with celiac disease, non-tropical flu. What radiographic features are most likely to have been visible on a small bowel edema? Reversal of jejunal and ileal fold pattern. In celiac disease, what do you see? Reverse of genital and ileal fold patterns. Question number 58. An 11-year-old girl presented with dysphagia over 3 weeks. She also has distinct skin lesions on her hand and feet with blistering. Her two other siblings have similar skin lesions. Barium swallow demonstrated multiple esophageal ulcers and stricture at the distal esophagus and esophageal web in the upper esophagus also identified. The most likely diagnosis is epidermolysis bullosa. Epidermolysis bullosa is our skin lesion on our hand and feet with blistering. Okay, and these are associated with esophageal ulcers and stricture in the distal esophagus. Okay, next question number 59. A 35-year-old woman with mucocutaneous pigmentation on her hands and feet and in circummoral distribution presents with cramping abdomen, well pain. She is found to have iron deficiency anemia. Plain radiography of the abdomen suggested small bowel obstruction. Contrasting HCT demonstrated general interception. The most likely diagnosis is Peutz-Jeghers syndrome. The Peutz-Jeghers syndrome may cause general interception and also has mucocutaneous pigmentation of hands and feet and cause iron deficiency anemia. So these all signs combined diagnosis is Peutz-Jeghers syndrome. Number 60, a 12-year-old female child presented with intermittent abdominal pain and vomiting over a 2-month period with no weight loss. On examination, there was voluntary hardening in the central abdomen but no peritonism. The inflammatory markers were raised and ultrasound showed a trace of fluid but no structural abnormality. The creatinine and approximate dates showed uptake in the stomach and right iliac fossa. On 20 minutes images was the most likely diagnosis, Meckel's verticulum. Now, on technique M scan, uptake in the right iliac fossa diagnosis is Meckel's verticulum. Question number 61. A 21-year-old female has a history of recurrent aspirin pneumonia for 1 year. She has fluid level within the mirror's on chest X-ray. Barium swallow examination showed absence of primary peroxide. The most likely diagnosis is primary achalasia. 20-year-old female history of recurrent aspirin pneumonia for 1 year, and then she has fluid level within the on chest X-ray. Barium swallow examination showed absence of primary peroxide. The most likely diagnosis is primary achalasia. There is absent primary peroxide seen primary achalasia. 62. A patient presented to a pediatric trauma in abdomen. Blunt trauma to duodenum presented as intramural hematoma. Blunt trauma to the duodenum presented as intramural hematoma.